Mary, hi.
We made it.
Yes, we did. Okay, so let me just tell everybody, thank you for visiting us on Facebook at Gold Medical Jobs. We are late because the internet went away and we got it back. So we thought, oh, we're going to still talk to everybody. So Mary is my good friend. We're both RNs. And she visits us at Gold Medical Jobs and shares lots of different things about healthcare that she knows from the administrative perspective. And right now, I think I want to focus on what she's doing because I think nurses and other healthcare people don't put the focus here very often. And she has begun a wellness business, and it's on the East Coast. And so, Mary, today I'm going to use this time to kind of interview you, okay?
Great.
Okay. Okay. So my first question will be, what kind of wellness does Vazendah provide? I think there's several modalities. So if you could just speak a little bit to each one of them.
Okay. Well, first I want to say that, wellness is very misunderstood. Everybody defines it differently. You can go to a candle store and that's wellness, right? I mean, so there's so many different ends of it. And where we've gone to is really the health end of wellness. So the modalities that we're offering are acupuncture, along with cupping, along with in-light LED therapy. Then we have massage therapy. And the massage therapists, though licensed as they would be for a spa, have additional training and certifications to take care of patients who actually have cancer or who have lymph issues or who need cranial sacral, as well as reflexology. And then we have energy work. So it's a combination of Reiki, shamanic healing, and integrated energy. And then I'm a certified well coach. So from a health and wellness coaching perspective, that's the third component of it, or the additional component. We are also affiliated with a physician who helps us do preventative work.
Wow, that's gigantic. So you mentioned words that I'm not even really, craniosacral and then Reiki. Are some of them the massage therapist's world or some of them your acupuncturist world?
Actually, they're trained and certified practitioners just in the energy world. So Reiki is also like wellness. Reiki is not Reiki. There are many different levels of Reiki, and there's many different types of practitioners of Reiki. So the Reiki that we're offering are people who have, extensive certification and hours in Reiki training and are Reiki masters. There's like a Reiki 1, a Reiki 2, but it doesn't matter. I mean, any energy work is good. You just want to make sure the person who's doing it has good energy, if you will, themselves. And then shamanic healing is based off the shamans. And as you know, all of these alternative therapies are thousands of years old. When you think of civilization existing, they didn't have antibiotics, didn't have surgery, didn't have pain meds. So the way civilization survived was by using these alternative therapies. And clearly it worked because we survived.
Well, here's a thought. My daughter's pregnant now. Mm-hmm. Your daughter just had a baby. And that's a time where the Western medicine that we're accustomed to, the antibiotics and, different things that we use, symptomatic relief in medicine, she's not really comfortable or even directed by her physician to use. So it's back to, like, if you're nauseated, peppermint oil, if you're something else, lemon oil, and so forth. So is that part of that ancient medicine that you're learning as well?
It is essential oils. So an interesting story. One of the brands of the essentials oil is called Thieves. An odd name for essential oil, right? And the reason that it's named Thieves is
can you spell that?
Like a thief, Thieves.
Okay, Thieves. Okay,
right. So a couple thousand years ago, when people of high stature, the aristocrats and stuff, would die, they would get buried with their stuff, right? Today, if we got buried with our stuff, we would need a cavern to bury us, right? But they would get their essential oils, they would get their herbs, they would get their jewels, everything would go in the grave with them. Well, years later, people would rob them. right? They'd rob the graves and they would take the jewels and stuff. So they found that the people who robbed the graves and did not take the essential oils and the herbs ended up getting sick and dying and having disease. And the thieves who did take them actually lived healthier. Isn't that amazing? Just from those essential oil and those herbs. So that's how the name of thieves came out. A little tidbit.
That's cute. That's cute. That's cute. Okay, so let's move on. You've told us different wellness therapies that are offered, the different modalities. Who would the client be? Would it be teenagers? Would it be elderly? Who are your clients?
Well, our tagline is wellness for everyone. Because typically, and you know me, and you're the same way, we're spa spoiled, right? We seek out spas. We want the massage. We want the relaxation. We want the do me experience, correct? Yes. But there's a whole portion of the population that doesn't want that. So our organization or our company is really targeted to people who it will benefit them from a health perspective. Yes, they will absolutely get the relaxation component, but really acupuncture really does help release endorphins. It helps releases pain. It helps with sleepless, people who have trouble sleeping. It helps with autoimmune. Massage helps with moving lymph, circulation, muscle tightness, pain, and energy helps with all that as well. So it really is taking care of the body as a whole, as opposed to today in healthcare. We go to a doctor and you have a diagnosis, right? I mean, how many times, I can't tell you, this is how you go to the doctor and you go into the, let's say you go into the gastro guy, right? And while you're there, you say, I have a sore throat. Could you look? No, I'm sorry. I can't look at your throat. You'll have to go to your GP. I mean, really? So we're looking at taking care of you from a cellular level up as a holistic perspective.
So good for all ages.
Good for all ages.
Okay. So here's another piece, because I know when I've needed treatment, other than maybe an antibiotic, you stay on that for 3 days, 10 days, whatever. Physical therapy, it's usually 2 or 3 times a week, practice at home. We're going to continue this and reevaluate it in 1 month or 6 weeks. How does it work when you're, say you're going in for a specific issue? I know years ago, Western medicine wasn't helping me and I was having repeated earaches. So I went in and I had very intensive treatment. And then the physician, the acupuncture doctor suggested, come in every quarter and let's give you like a boost, let's charge up your immune system so you don't get another infection. So what is the average patient or client, I should say, that your people are seeing? What can they expect as far as a commitment of time?
It's going to change for everyone. And everybody responds differently. I will tell you that acupuncture is not a one and done. If you go to acupuncture and you expect to be cured, it's like going to a physical therapist and expect to get cured. It's not going to happen because it builds itself. So depending upon what you're going for will depend on what the treatment regime is. Same thing with massage therapy. I could get massaged every day. I would be okay with that. But for some people, it really does give them a lot of relief. When you have arthritis and because the other thing is, our practitioners are certified to work on the elderly. A lot of times elderly don't want to get massaged because they're afraid they're going to get hurt. Right? The massage therapy will hurt them and stuff. But at the same time, moving that tissue and moving the lactic acid that's in by the muscles really is helpful to them. So it's really streamlining the approach to the person and the needs.
I love it. Okay. And finally, Mayor, we don't have to limit this to today, but I'm trying to make our videos a little shorter so that people we're so late today, and I apologize about that. But what kind of cost? I mean, is it something that insurance covers?
Many insurances will cover acupuncture. With the diagnosis code. Today, they don't really cover massage or coaching. They will in the future because the trends are going that way. However, if you have an FSA or an HSA, you can ask your practitioner to give you a bill. They pay you, and then you get the bill to submit to the insurance. And you may get a piece back from your FSA or HSA, particularly those two, because that's money you're putting aside for eyeglasses or other things that, aren't covered by the insurance, but are medical in nature.
Okay. Okay. That's super helpful, Mary. Do you want to give your website or maybe your location, your
Sure.
hours?
Well, we are located in Warwick, New York. Coaching we can do anywhere around the country. The website is www.vazendah, VAZENDAH.com. If you follow us or like us on Facebook and Instagram, you will benefit from all the information we're going to give regarding prevention. Because one of the targets is, as a nurse, my passion really is to help people prevent disease. And all the treatments we're doing are part of that because we're working at the cellular level. We're not working at the exterior, we're not the body shop, like when you go to the automobile and they take care of the body.
Yeah.
We're in the transmission. So we're going to have lots of things that will be on there. And if you're ever in New York, who knows? I may be franchising anytime soon.
So you're saying basically we can get health tips and wellness tips just by visiting your site.
Right. And signing up, follow us on Instagram or Facebook.
Okay, great. Okay, I have done that actually. All right, Mary, thank you. I'm so sorry to keep you waiting as I have no control over the internet. Fortunately, it came back. We can get back to business. And I'll see everybody on Wednesday. And Mary, next week I will be out of town on Monday. So maybe we'll work on Wednesdays again because that was a good time, a good day. We're just going to try a later time, correct?
Sounds good.
Are we saying like 8 o'clock Eastern time?
We will. What time is what day is next Wednesday?
6, or did you say 6 o'clock next Wednesday?
I'm looking. Hold on. Next Wednesday is
The 20-something.
the 28th. Actually, I'll be bringing Susan into the hospital that night. So I'll probably could do earlier because I'll move my day around. So we'll talk and come up with the time.
Okay, that's okay. That's a pretty big commitment, Mary. So we will, as I get through this week and talk to you again, we'll let everybody know when you're going to visit us again because Vazendah sounds like what the 21st century really needs.
Oh yeah,
So,
and I mean, where do you hear what I've learned about sleep, particularly as it relates to healthcare? It's like crazy. I mean, people employed with healthcare.
Let's focus on that because I remember my mother-in-law always saying that, oh, I slept like a baby last night, and I didn't understand that. But as she got older, and as I'm getting older, I don't always sleep like a baby, and I appreciate when I do, and I don't quite know what to do when I don't. I just read a lot.
Tips to come. After her surgery, we'll get on a routine of every Wednesday, which will be pretty much in stone. But right now, so my sister is having open heart surgery because she smoked. There you go.
I say that to my mom. We all, none of us really, we all kind of goofed around with those stupid cigarettes, right? All right. Well, hang on.
Have a great week.
You too, Mary. I wish you great health and everybody else out there. Thank you.
All right. You too. Bye-bye.
Bye.